guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering infectious disease processes. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There are plenty of resources there available for you. You can sign up for a one-on-one private tutoring session, or maybe you just want to pick my brain about something. You can sign up for Next Generation NCLEX Review Part 1 and Part 2. Part 1, I teach you how to think like a test writer. I teach you how to think critically. I teach you about priority and delegation and certain scenarios that the test writer may give you and where your brain's supposed to go. And then in Part 2, we actually go over NCLEX type questions. We go over rationales, important things you guys need to understand. There's something else I was going to tell you. Oh, yes. And my Next Generation NCLEX reviews are only offered once a month, so be sure to check those out. If you're a current nursing student, I have something for you too. Audio lessons. If you have to do really well on your next exam, be sure to check out the audio lessons that I have available. Again, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, right here on YouTube. My handle's the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Infectious disease. Infectious disease is... All right, first question. Which teaching would you include for a patient with mono caused by Epstein-Barr virus? You can return to contact sports once your symptoms improve. Avoid sharing drinks and/or utensils with others to prevent spreading the virus. You'll no longer be contagious once your fever subsides. You should start antibiotics immediately to prevent complications. Very good. First of all, something you guys have to know for test-taking purposes, the virus, the name of the virus when it comes to mono is Epstein-Barr. You need to know that. And important teaching, you're going to tell them to stay away from sharing drinking utensils or food, because that's how you spread the virus. It's primarily spread through what? Saliva. That's why it's also known as the kissing disease, right? From kissing. DMA says, I hate that I changed my answer. I hate that you changed your answer. A lot of students will get questions wrong because they change their answer. And usually your first instinct, the first answer you go with is the correct answer. Don't talk yourself out of the correct answer. Don't do that. Let's look at the wrong answer choices. You can return to contact sports once your symptoms improve. Absolutely not, because here's the thing. We're going to be concerned about what? The spleen, splenic rupture, splenic injury. So absolutely not. You better go play a singular sport, not contact sports. You better go play golf or bowling or something that you do by yourself, but you're not going to be out there playing basketball or soccer or rugby or anything like that. Forget about it. Next, you'll no longer be contagious once your fever subsides. That's not true. Even though the fever subsides, you can still be contagious for weeks, even months after those symptoms have diminished or gone away. So that's false. And then you should start antibiotics immediately to prevent complications. I'm happy only 9 people chose this answer. How are you going to start antibiotics when this is a viral infection? Antibiotics are given for bacterial infections. In the question, it tells you it's caused by Epstein-Barr what? Virus. This is a viral infection. Do we ever give antibiotics for viral infections? Absolutely not. Okay, next question. Which of the following triggers would you teach your patient to avoid to reduce the recurrence of herpes simplex type 1? Is it exposure to light, dehydration, exercise, or high protein diet? Which of the following triggers are you going to teach your patient to avoid to reduce the recurrence of herpes simplex 1? Oh, wow. Most of you guys chose dehydration. No, it's exposure to light. First of all, let's talk about herpes simplex. This is a viral infection. You have one, two. One tends to be above the belt, lip. Two, genital, right? Below the belt. So two's below the belt, one's above the belt. Now, this is a viral infection and triggers exposure to light, illness, stress. And when I say stress, not only, psychological stress, but physical stress. If you're sick, that's a physical stress on the body. Those are triggers that can cause a recurrence. So you're going to teach the patient about that. A patient presents with a sore throat and fever. The patient tests positive for group A strep. What's your priority nursing intervention? Is it to recommend increasing fluid intake and rest without medication? Is it to initiate contact isolation precautions until the fever subsides? Is it to administer the prescribed antibiotics, or is it to delay antibiotic therapy until symptoms worsen? Very good. You're going to give the antibiotics as ordered. So your patients tested positive. First of all, they have a sore throat and fever, and they tested positive for group A strep. So that is the bacteria that is causing them that sore throat and fever. It's a bacteria. What are you going to give them? Antibiotics as ordered. Now look at the choices. Recommend increasing fluid intake. That's great. We want to keep the patient hydrated, especially they have a fever. They're going to be at risk for dehydration. But look at the rest of this answer. And rest without medication. Your patient has strep and you're not going to give them antibiotics? Absolutely not. And guys, this is why it's so important to read the whole answer choice, because the first part of the answer choice is going to be beautiful and it's going to throw you off. The whole thing has to be beautiful. The whole thing has to be correct, or the whole thing is wrong. Next, initiate contact precautions until fever subsides. This is a group A strep. Patient doesn't need to be on contact precautions, so that's false. And then last, delay antibiotic therapy until the symptoms worsen. What? No. That patient tests positive, they're going to get antibiotics, and you're going to teach that patient to take those antibiotics as ordered, even if they're feeling better, to complete the full course of therapy. Okay? You're planning care for a patient with active tuberculosis. Which infection control measures should you implement? Is it standard precaution with a surgical mask? Is it droplet precautions and wearing a surgical mask? Is it airborne precautions with an N95 respirator? Or is it contact precautions with gown and gloves? What do you guys think? Very good. Airborne precautions with an N95 respirator. So let's talk about tuberculosis. It's caused by a bacteria called Mycobacterium tuberculosis. Sometimes on tests, it won't say TB, it'll say Mycobacterium. When you see Mycobacterium, this is what they're talking about. You need to be thinking about tuberculosis. And the patient's going to be on airborne precautions. They're going to with an N95 respirator. And here's why. When it comes to airborne, these particulates are very, very small. They're going to be less than 5. What does that stand for? Not mini microns. Micro? No. Oh my gosh. What does the stand for? Micromillimeter? Oh my gosh. I don't remember, guys. I'm having a brain fart. But I'll tell you now, when it's airborne, it's very, very small. It's less than 5 mm's. Is it nano micrometers? Maybe. I promise you, I'm having a fart in my mind. But it's less than 5. If we were talking about something bigger like droplet, it would be more than 5. Micrometers. Yes, I said micrometers, didn't I? And I doubted myself. See, don't be like me. That's what I'm saying. Don't talk yourself out of the correct answer. I'm almost sure it's micrometers, but I might be wrong. Anyway, airborne, very small, less than 5. Professor D, do I need to, because that's your magic number. Do I need to know less than 5? Absolutely. Okay. Patient's going to have N95. Or you're going to wear an N95 or powered air, purifying mask. Okay. That's very important. Now, other options, standard precautions and surgical mask. Standard precautions and surgical mask, not enough. Droplet precautions. Remember, droplet, that's for the larger particulates. Okay. So no, we're talking about TB. Surgical mask, not enough. And then contact gown and gloves, no. So we're going to do the airborne precautions and 95. Professor D, do I have to know all of this? Absolutely. If you're currently in the program right now and you study infectious disease, you're going to get more than one question on TB. Your patient's positive for cytomegalovirus. Include the patient's teaching plan to reduce the risk of fetal transmission. Avoid contact with children as they're common carriers of the virus. There is a vaccine available to prevent CMV infection during pregnancy. You should be prescribed antiviral medications to cure the infection, or frequent hand washing can reduce the risk of passing it on to the baby. What are you going to teach? Yes, negative pressure room with tuberculosis. Okay, the correct answer. Okay, you guys hardly even answered. Only 9 people chose the correct answer, frequent hand washing. Listen, listen to me, guys. If you listen to anything that I tell you in this whole Kahoot, if you're only going to listen to one thing, listen to what I'm about to say to you. When it comes to the transmission of infection, every single day of the week, the number one way to prevent the transmission of infection, and it doesn't matter what kind of infection we're talking, number one way is always going to be hand washing. Hand washing. Okay, so you're going to teach them to frequent hand washing. Now, here's the thing, cytomegalovirus, this is a viral infection, and it belongs to the herpes family. Okay. Avoiding contact with children, that's not necessary. Yes, children can be carriers, but it's not necessary to avoid contact with children. There's a vaccine available. No, there's not. You should be prescribed antiviral medications to cure the disease. No, there is no cure to the infection. The only correct answer here, guys, is going to be frequent hand washing. Not enough time. You guys are given a whole 30 seconds. For the Kahoots, you get 30 seconds for the multiple choice answers, and you get a full minute if it's a select all that apply, or an ordered response, or a fill in the blank. It was? Okay, I apologize if it was faster than that. Which of the following infection control precautions would you implement to prevent the transmission of Ebola? Standard precautions with surgical mask and gloves, airborne precautions with N95 respirator and negative room pressure, contact, droplet, airborne, and impermeable gown, face, shield, glove, N95, or droplet precautions with face mask and gown. What are you going to choose? Very good. Everything. Let me tell you something. Ebola is no joke. Okay? It is very, very, very contagious. It's very contagious, very lethal. You could get it from contact, like direct contact or body fluids. Most people, I don't want to say the word for TikTok, but most people, they go by hemorrhagic fever. That is a horrible way to go. Okay? Very lethal, very deadly, very contagious. Contact precautions, droplet precautions, airborne precautions. You're going to wear impermeable gown. You're going to wear a face shield. You're going to wear gloves and N95. Select all that apply. What would you teach a group of patients about decreasing their risk for developing an antibiotic-resistant infection? Select all that apply. What are you going to teach them? Here are your options. Take antibiotics to prevent illness. Do not take antibiotics to prevent illness. Wash hands frequently. Wash hands seldomly. Take antibiotics when feeling sick, or take antibiotics when prescribed. These are your options. What would you teach a group of patients about how to decrease their risk of developing an antibiotic resistant infection? What is an antibiotic resistant infection? Those are bacterial infections that are resistant to antibiotics. They're not sensitive to those antibiotics. Why? What's happened is, this patient's been taking antibiotics since they were a kid. Their bodies just basically develop resistance to everything under the sun. And now they're really sick, and we can't give them anything because their body's resistant. Let's talk about it. 11 of you guys chose take antibiotics to prevent illness. No. That is a way of increasing your risk for antibiotic resistant infections. There are just very select and particular cases where we would give antibiotics prophylactically, right? Very specific cases, but generally speaking, you do not do that. Otherwise, you increase your risk of developing antibiotic resistant infection. So we're not going to choose that. Next, do not take antibiotics to prevent illness. True. We don't want them doing that. That's good. Wash hands frequently. True. Very good. Wash hands seldom. How did 5 of you guys choose wash hands? It's always a good thing to wash hands. So we're not going to choose that. Take antibiotics when feeling sick? No. But yes, to take antibiotics when ordered, when prescribed, and also take them as ordered. Select all that apply. What would you teach a group of patients about decreasing their risk for developing antibiotic resistant infection? Same question. So more teaching. What would you say? Always complete the full course of antibiotics, even if you start to feel better. Do not use antibiotics for viral infections such as a common cold. It's okay to save leftover antibiotics for the next time you feel sick. Only take antibiotics that are prescribed specifically for you. Take antibiotics every time you feel unwell to prevent complications. Practice good hand hygiene to reduce the spread of infection. Those are your options. Okay, let's talk about it. The first option, always complete the full course of antibiotics, even if you start feeling better. Absolutely. Because if you stop taking those antibiotics once you start feeling better, guess what? Those bacteria, they're very smart. They will start to reproduce and they will be resistant. So we need to eliminate all of them. Do not use antibiotics for viral infections such as a common cold. True, because a common cold is a viral infection. We do not give antibiotics for viral infections. Very good. It's okay to save leftover antibiotics for the next time you feel sick. Absolutely not. You need to take the entire course to make sure that all of that bacteria is eliminated. They don't have a chance to reproduce and get stronger. Only take antibiotics that are prescribed specifically for you. Absolutely. Because guess what? Whatever your friend is resistant to, whatever they're sensitive to, may not be what you have going on. Your body may not be resistant or sensitive to that particular antibiotic. Okay. So only take what's been prescribed for you, what you've been tested for. Take antibiotics every time you feel unwell to prevent complications. No, very good. Only one person chose that as an answer. And last, practice good hand hygiene to reduce the spread of infection. Yes, that is the #1 way to decrease the spread of infection. Select all that apply. Which of the following would you include to reduce the risk of healthcare-associated infections? Healthcare-associated infections, these are infections caused by microorganisms within the healthcare setting. Here are your options. Perform hand hygiene before and after contact with every patient. Use sterile technique when inserting urinary catheters. Administer antibiotics to all patients admitted in the hospital to prevent infections. Ensure central line dressings are changed per facility policy and as needed. Use PPE based on the type of care being provided. And encourage patients to stay in bed to avoid falls and reduce movement. So which would you teach? Which would you include in your teaching when you want to prevent healthcare associated infections? When we want to prevent infections caused by microorganisms within the healthcare setting. Okay, let's go through them one by one. Perform hand hygiene before and after contact with every patient. That's right. We're not trying to bring one patient's, pathogens and microorganisms to the next. Very good. Next, use sterile technique when inserting urinary catheter. Absolutely, because guess what? As you're inserting that urinary catheter, you can also be inserting what? Pathogens into that patient. You don't want to be the one to give that patient infection. Very good. Next, administer antibiotics to all patients admitted in the hospital to prevent infection. I think by now, everyone's got it, except for the one person who chose that as an answer, that we don't give antibiotics just to give it, just to prevent. Very good. Next, ensure central line dressings are changed per facility policy and as needed. Yes. Why? Because if, God forbid, you introduce a virus, a bacteria, a fungus, any pathogen, any microorganism into that central line, you want to know where it's going to go? Directly to the patient's heart. Do you want to be responsible for your patient? Absolutely not. Next, use PPE based on the type of care being provided. Absolutely. That's going to help stop the spread of infection. And last, encourage the patient to stay in bed to avoid falls and reduce movement. No, absolutely not. That the more that patient stays in bed, the more that movement is restricted, the higher their risk for getting infections such as what? Pneumonia, right? We want the patient to turn, cough, deep breathe. We want them moving around. We want those lungs to expand. We want early mobility. Absolutely. Having them stay in bed, not moving, they can get infections such as pneumonia. They can get DVTs. They can get pulmonary embolism. They could have all types of issues. So no, we want early mobility. Oh, wow. Last question. Which of the following PPE should you wear when you're entering a patient's room with C. diff? C. diff. Okay. Gloves only, gloves and surgical mask, gloves and gown, or gloves, gown, and N95. And I put this picture on here because, my goodness, once you have smelled C. diff, you'll always recognize that smell. It's very distinctive. Very good. Gloves and gown. Okay, so C. diff, guys, this is a bacterial infection and it's found in the large intestine, and it's transmitted by contaminated surfaces or the feces. Gown, gloves, not gloves only, that's not enough. Gloves and surgical mask. Why the surgical mask? There's no portion of respiratory particulates, so no. And gloves, gown, and N95. Again, N95, that's not necessary. There's no respiratory particulates that we're concerned about, but gown and gloves, okay? And that was it. There was only 10 slides on this, guys. Let me know if you want to see more on infectious disease processes, because there's so many more that you're going to be questioned on if you're in the nursing program and if you're taking NCLEX. So I definitely could do a part 2, 3, even a part 4. Let me know if you guys want to see more on infectious processes. And do you want it in a Kahoot format, or do you want it like the other videos that I do on YouTube where I do Q&A format, or maybe even a lecture? Let me know in the comment section. Let's see how you guys did.